Hello, and thank you for your interest in SBIRT. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. My name is Scott Caldwell, and I am the SBIRT coordinator at the Wisconsin Department of Health Services. And we have prepared for you a series of brief video clips which will describe SBIRT, get you to consider some reasons for pursuing training in SBIRT. We're going to provide a brief demonstration of the model, and then finally, in the last part, we'll talk about a couple of upcoming training opportunities. So what is SBIRT? A patient coming in for an annual checkup receives an alcohol and drug screening, which includes questions about tobacco and behavioral health concerns such as depression. And if that patient's results of screening shows moderate or a higher level of risk, then a health educator or a member of the healthcare team would follow up with that patient and provide a brief intervention. When we mean brief intervention, we mean up to 10 or 15 minutes, and the intervention is guided by a protocol using motivational interviewing. SBIRT is readily adapted into school settings delivered by members of the multidisciplinary Student Services team. Since 2012, the Department of Public Instruction has gotten involved to highly endorse this model for delivery in middle and high schools. So we're talking with adolescent students, and has sponsored a series of trainings. Why consider delivery of SBIRT in your good work? Well, we like to suggest 4 primary reasons. Number 1, this is an evidence-based practice. So think of working with students ongoingly who present with several different concerns, including behavioral health. SBIRT helps to very efficiently kind of get to the bottom of those concerns and offers a powerful intervention model for promoting change. The second reason is that training in this model can increase your own comfort, your own confidence in having what are often difficult or delicate, sensitive conversations about, for example, alcohol or illicit drugs or tobacco or depression, anxiety, or other sorts of mental health concerns. The third reason to consider SBIRT is that students very much value, they appreciate, they are often highly satisfied being on the receiving end of brief intervention. The final reason to consider SBIRT into your practice is that this fits with emerging paradigms in schools, PBIS. So even though SBIRT is really built as a universal screening approach, universal screening is not going to be feasible at all in the school setting with current staff. So again, thank you for your interest, for taking your time, and we hope to see you in a minute in the next video.